Hi, this is Jessica DeMassa, and I'm here with Susan Williams. She is the CEO of Agency Other, and she's also the director of the HealthTech Women Los Angeles Hub. Hi, Susan. Welcome.
Hi, thank you.
So I understand that the HealthTech Women LA Hub is just launching. So tell me a little bit about that.
Yeah, really excited. This is a global syndicate of women. It's about 20,000 women strong. It's launching in a couple different areas in the country, but then also in Tokyo as well.
Oh, cool.
And Los Angeles is one of the areas that it's launching. We're kind of a little bit late on celebrating International Women's Day, but it's launching March 14th in Miracle Mile.
Oh, very cool. So, okay, so tell me a little bit about not only like the women's health tech scene, but the health tech scene broadly in Los Angeles. What's that like right now?
Right now, so I moved there about 3 years ago, and it felt like it was just beginning, or at least like it felt like it was becoming more and more visible. And in the last 3 years, it's definitely burgeoned into something that is, it's becoming a city where people are starting to pay attention. There's kind of, we're trying to get more investment interest. We're trying to get more companies to kind of be more better showcased, and communities are starting to come together and support each other.
And so why do we need a women-focused tech organization, specifically in health, especially in LA?
Yeah, so one of the things that I started to do about a year ago was I launched this organization, or this community called Digital Health Support Group.
We definitely need a support group in digital health. Brilliant.
And it's made up of a whole bunch of people, engineers, founders, investors, who've been around the block a couple of times. They've started companies, they've exited, their startup has failed, whatever, but they know the story. And so they've come together, and we're tapping into each other's networks. And I am literally one of maybe 3 women in this group, and it's a group of 60. So there was that.
Yeah.
And then also just the continual awareness of the lack of women presence in health specifically, and then technology generally.
Oh my gosh.
And it's just, we just have to do something about that.
I always keep saying, I'm like, here at HIMSS, I'm like, we'll know we've achieved some sort of like parity when there is a line at the ladies' room instead of at the men's room at HIMSS.
Yeah.
That's how we will know we have made it.
Yeah, absolutely.
No, but it's true. It's about 90% men here, don't you think?
Yeah, lots of suits.
Lots of suits.
Yep.
So I know there's a lot of challenges. I mean, not only just being outnumbered, but one of the things that I find particularly challenging is that there seems to be a lack of like women mentors. Like it's been really hard to find like another woman to mentor me. Do you feel the same way? And is like HealthTech Women doing something about that?
100%. And I think the first thing is even knowing what I need in terms of mentorship.
Right.
What I don't even know what questions to ask, so I don't know who to look for. And so there's that. And then there's trying to connect in a way that is useful and then also accessible to both the mentor who's already tapped and, doing their lean-in thing, and then also the people who are needing the support. Just how do you facilitate an easy relationship there? And so what HealthTech Women is trying to do is first establish a community, and then secondly, we're going to be developing a mentor platform that helps match, but then also helps facilitate those relationships and helps people who are looking for mentorship really understand what they're doing and what they need, and then helps mentors really be able to help and support in the way that is needed in a better way.
Yeah.
It's more efficient.
No, and I think that's great. I think it's good that it's organized in that fashion. Last question for you. We've been asking everybody, being as this is WTF Health, we want to know what your WTF Health moment was, where you first felt like, oh my God, we've got to be able to do better than this. What's the future, WTF Health?
So I've been to a couple of conferences in the last 7+ years-ish that I've been involved in the digital health space. And I think at every single conference I've been to, somebody has mentioned fax machine. Somebody.
Always.
And the audience has always giggled about it.
Like, fax machine.
Fax machines. Oh my God. But then it's like 7 years later, we still haven't advanced from the fax machine.
And that's still a joke.
That is, yeah. What?
Yeah.
What WTF?
Yeah, right?
What WTF?
We need to get past the fax
machine. Yeah.
Good. Susan, always a pleasure to chat with you. Best of luck with the launch of HealthTech Women in Los Angeles. If people want to find out how to join that or any of the other chapters, where do they go?
They can email me at susan@healthtechwomen.com.
All right, fantastic. Yeah. Thanks so much for joining us.
You're
it's a
welcome.
pleasure to talk to you. Thanks a lot. This is Jessica DeMassa with Susan Williams. Thanks so much.